All right, we were recording. All right, hello, good afternoon, everyone. So my name is Carly Lighthizer, and I'm the Extension Program Specialist for the Center for Public Issues Education, also referred to as the PI Center here at UF. And I'm also part of the Outreach Corps for the Southeastern Coastal Center for Agricultural Health and Safety. I'm super excited to host and moderate this webinar with two presenters I know very well. This webinar is titled Research for the Next Generation, Reimagining Heat Illness Prevention and Communication, featuring Alejandro Mena Sánchez and Astrid Ericson. And before we get started with introductions, I wanted to brief you all on how this webinar works. So first, I'm going to introduce our presenters and provide a little bit of background information on their topic. And then then Alejandro will present for the first half and Astrid will present for the second half. And we're going to allot roughly 10 minutes towards the end of the presentation for you all to answer, or for our presenters to answer questions. So throughout both presentations, you can put questions in the Q&A box and they will answer them at the very end. And we will end promptly by 3 p.m. So now, a little bit about our presenters. Can you see my screen all right? Okay, a little bit about them. So if you looked at the description for this webinar, you might have seen that it said PI Fellow 2024-2025, and you might be wondering how that relates to agricultural health and safety or the Southeastern Coastal Center. So the PI Fellows is a student-centered program housed in the PI Center where I am in partnership with SCC-AHS. So students from a variety of academic backgrounds are brought together to work on social science research data focused on agriculture, natural resources, and health. So both Astrid and Alejandro completed projects in the field of agricultural health and safety, specifically on heat-related illness. And the results they gathered from both of their respective studies were pretty insightful, and we thought that this might be something helpful to share with Ag Safety Center audiences. Alejandro is a PhD student at the University of Florida studying environmental and global health with an emphasis on One Health. And Astrid is a master's student also at UF studying agricultural communication. And both of these talented individuals were part of the PI Fellows program for the 2024-2025 year. And with that, I will stop sharing my screen and allow Alejandro to share his and take it away.
Thank you so much, Carly. 1 second. Can you see my screen properly? Oh, wait 1 second. Here we go. You can see it properly, right? Okay, good. Thank you so much. Thank everyone for being here. Like Carly said, I'm a veterinarian from Mexico. I'm doing a PhD in public health with a One Health concentration here at the University of Florida. And I'm so excited to share this project with you. The title of my project is called The Influence of Social Determinants of Health on Heat Illness Prevention and Information Trust in Florida. So why to choose this topic? Well, for many people that from us who live in Florida, we know how hot the summers could be. So we experience long hot summers, and every year those temperatures continue to rise due to global and climate change. In fact, actually, last year in 2024, it was recorded the warmest year on record for both the United States and the world, and it was ranked the fifth warmest year, specifically in Florida. So we know that this prolonged exposure and frequent heat events are increasing concerns about heat-related illness, such as, for example, heat exhaustion, heat stroke, especially among the vulnerable populations, which is something that we will talk about in a few minutes. But this risk, as we will see, is not evenly distributed among the whole population. So to understand a little more about the importance of this topic and this heat-related illness, I'm going to tell you a little more about this condition. So it includes a range of health programs, which results from prolonged exposure to high temperatures. It can start with just mild symptoms like heat rash or moose cramps, and it can keep progressing to more serious outcomes like heat exhaustion, rhabdomyolysis, and even heat stroke, which can even lead to death. And this happens when the body can't cool itself effectively. The internal temperatures rise, and that leads to dehydration, fatigue, confusion, and like I said, in severe cases, it can lead to organ failure and to death. So symptoms of heat exhaustion can include nausea, dizziness, weaknesses, headache, irritability, and heavy sweating. So the most dangerous from that is heat stroke that can also cause seizures, loss of consciousness, and collapse. So this illness can also worsen other chronic health illness, for example, heart illness or respiratory conditions, making it especially dangerous for adult people like older populations or those with existing or pre-existing health problems. And here in Florida, this is a particular concern because extreme heat is part of the daily life of many months of the year. Basically, the whole year we're experiencing high temperatures. And some studies, for example, have shown that more than half of outdoor workers begin their shifts dehydrated, and over 80% are dehydrated at the end of the day. And some agricultural workers also experience acute kidney injury related to heat exposure, and about 64% report at least one heat-related symptom in a single week. So we can see how this is a huge issue, particularly here in Florida, because we have these outdoor workers, especially farm workers, which can be continuously exposed to these high temperatures that can put in danger their health. So to talk about more the methodology, this whole context led to our focus. We wanted to examine how social determinants of health, things such as income, education, occupation, the race, where people live, influence both prevention behaviors and the trust in heat-related information sources. That means the areas or resources that you can get to know how to avoid what is a heat-related illness and how to avoid them. So to understand why certain groups don't trust these health informations or take fewer preventative actions or none at all, we can help develop more effective and equitable public health strategies to reduce the impact of extreme heat in Florida. So as part of the fellowship, I had access to a survey conducted by the PIE Center on heat-related illness in 500 Florida residents. And this survey asked about participants' demographics, such as income, education, occupation, like I said, and it also included questions about heat-related illness outcomes, specifically their prevention behaviors, like if they stay in shades or they avoid outdoor work during extreme heat events, and their trust in different information sources such as CDC, DOH, social media, and how often they seek for these informations about extreme heat events. And to analyze this data, all these social determinants variables were recorded into ordered groups. For example, income was categorized by low, medium, or high income, as well as education. We separated political orientation, different type of race, as well as the settings where they live. And then we used a method called Bayesian profile regression, or BPR. And the important part of this model is that it groups people into clusters based on these social determinants of health profiles, based on their income, based on their education, where they live, and they link them together naturally. It's not something that you do manually. The model automatically allocates these people together based on these relationships. It kind of creates a risk profile for the populations that we're analyzing. So once we conducted these Bayesian models, we had 4 main clusters showing up from this model. Our first cluster is the balance group, is our reference group. It's a moderate income, moderate education, diverse racial and political mix. So it's the reference group for this analysis. In cluster 2, we have moderately advantaged people, mostly non-Hispanic white with moderate education and moderate income. And cluster 3, which is the one that we want to pay attention, is the most disadvantaged one. It has low income, low education. They are mostly Hispanic and Black individuals, and they live in rural, and many are agricultural workers. Cluster 4 is more transitional. They have low income and low education, but they live in urban settings and have professional occupations. So this is a transitional cluster. The key findings from this analysis, all of those analyses were conducted in our software, and the goal was to identify, like I said, which social profiles were most vulnerable and for heat-related illness, and also who are those that trust less in heat-related information. So after identifying the clusters, we run logistic regression models to test how each of these clusters was associated with low prevention, low trust, and low information-seeking behaviors compared to our cluster 1, which is the baseline. And overall, cluster 3 was the disadvantaged group. They were less likely to engage in predictive actions and were more likely to distrust in health professionals and government information sources. We have cluster 2 and cluster 4 showing some selective distrust also towards social media sources, but not as strong as our cluster 3, which is now looking for shades or predictive actions, but also are not trusting in the sources where they can get that information to conduct these preventative measures. So those were the findings from our study. And through my collaboration with the PI Center, I had access to this data, but also to collaborations with Dr. Andres Manrique, Dr. Ashley McLeod, with Carly also assessing me to conduct this whole process. And it helped me to understand new procedures as well. So I'm really thankful to the PI Center, and I want to thank that. And as a future steps, I believe that this is something important because we need to understand why these people is not taking these preventative measures and why they are not trusting in the sources. So qualitative data approach will be a good research method for understanding these populations. And it's something that I would like to plan to do in the future. And also as a result from this study, we successfully submitted this manuscript to the Journal of Health and Social Sciences, and it was accepted. So I'm very thankful for this whole opportunity. And here is my contact information in case you have any extra questions or want to know a little more about the project. And thank you so much.
Great. Thank you so much, Alejandro. And again, if you have any questions, please place them in the Q&A. We'll go over them at the very end after Astrid completes her presentation. But yeah, that was great. Thank you, Alejandro. So Astrid, you're welcome to start sharing your screen for your presentation.
Yeah, thank you, Carly. Okay. So I just wanted to thank everyone again for coming. This is my PI Fellows research, but it was also my master's thesis. So it's truly a labor of love over the past 2 years, and I'm really excited to share it all with you. And this is evaluating diverse video formats for heat-related illness prevention in agricultural workers. So Alejandro went into this already a little bit, so I'll try to make this speedy. But we're jumping right in by asking what are heat-related illnesses. And according to the CDC, heat-related illnesses are any sickness that occurs due to the body's inability to cool down. These illnesses include extreme things like heat stroke, but it can also include cramps and even sunburn. And long-term reoccurrence of these illnesses can result in kidney and heart failure. And in extreme cases, you can die from them. So it's definitely a concern. And agricultural workers are specifically at risk for heat illness. Long days, extreme temperatures, and overexertion all play a role in developing heat-related symptoms. And because of this, agricultural workers are 35 times more likely to develop a heat-related illness than the average person. And that statistic is pretty staggering, so it really shows the need for effective communication materials. So we selected video as our medium to study because Americans in general prefer video to print. They find it more entertaining and easier to understand. Additionally, video is considered rich media. So that means that videos are more eye-catching, emotion-provoking, and entertaining than print and photography. There's also extensive evidence that video is the most effective communication medium for changing behavioral intent. We've seen this in public health campaigns, but we've also observed it in education, politics, and social justice communications. And finally, the communication world is changing. There's been a very abrupt shift in the past 5 years from traditional print media to short form videos being the #1 form of informational content that Americans consume. I personally attribute this to TikTok and Instagram Reels, but regardless of the origin, we have to be willing to keep up with the trends in communication. And that brings us into our theoretical frameworks. So for this study, we used 2 theoretical frameworks when creating our survey instrument and guiding our research questions. The first is framing theory, which is the idea that how we communicate a message affects how the message is received. A really great example of this is the Republican Party reframing tax cuts to tax relief in the early 2000s. The message was still the same, but the frame was different. This theory fits our research because all videos evaluated communicated the same message of heat-related illness risk. They just used different frames to communicate that message. And then the second theory we used is trust ecology. Trust ecology refers to how different types of trust may interact. The theory postulates that there are 4 types of trust: dispositional, procedural, affinitive, and rational. And while this theory is typically applied to the human dimensions of natural resource management, we found that the concepts of trust and how trust is processed fit really well with what we wanted to study in this article. So, a big question that's been asked throughout this whole process is why trust? And in this study, trust refers to cognitive trust or an individual's belief that certain media services are dependable. Trust encourages behavioral seeking information or information seeking behavior, excuse me, and has had an effect on behavioral intent. Because of these things, it's imperative that audiences trust public health messages. Despite this, there's currently a lack of trust in public health messaging, particularly in rural and agricultural areas. This is due to a really long, difficult history of disparities in infant and maternal mortality, water safety, and healthcare access. Additionally, during the COVID-19 pandemic, public health messages were inconsistent and a little hard to understand, and this led to a lack of credibility and feelings of suspicion from diverse audiences. Um, Public health practitioners have a long ways to go in terms of gaining trust in rural America. Previous literature has suggested that creating media that the audience can relate to and building connections through that media will be helpful when trying to gain trust. And that brings us into our research questions. So we had three for this study. It's how do different video formats impact trust of heat-related illness prevention information? How do different video formats impact likability of heat-related illness information? And what video format is the most effective in communicating heat-related illness prevention strategies? So for this study, we selected 4 videos shown on the chart that communicate heat-related illness risk in farm workers. The first is a Financial Times video, which is a large, nationwide news source. And then the second is a more local news source. It's KOHU 11 News, which is based in Houston, Texas. And then we have a California Heat Illness Prevention Study video that was produced by UC Davis for heat-related illness prevention education. And the final was created by OSHA. These videos were each assessed based on likability and trustworthiness. For the study, we used Dialsmith, which is an online continuous response measurement tool. Trustworthiness was assessed through survey questions after viewing each video. Trust ecology guided the questions we asked, which ranged from do you trust this video to would you share this video with loved ones? And likability was assessed through continuous response measurement, which brings us to our next slide. Continuous response measurement is a tool used to measure audience reactions to a message as it happens. So for this study, we used Dialsmith, which is an online continuous response measurement program. And as they watched the video, they slid a sliding bar. On one side, it said, I don't like it. And on the other side, it said, I like it. And as they watched the video, they slid their bar so that we got real-time data on whether they liked the video or not. CRM allows us to get really rich, in-depth data, and that's because we literally get data for every moment of the video. This is interesting because we can see how their opinion and interest changes as the video continues. As I mentioned, this study was conducted through Dialsmith, which is an online CRM platform. Surveys were asked to watch the videos and then ask survey questions after the completion of each video. They were also asked which video was their favorite at the end. So independent variables, included where surveyees lived and their ethnicity. It also included the actual stimuli, so the 4 videos. And then dependent variables included likability and interest level of each video, as well as the perceived level of trust. So overall, likability was assessed by taking the average of each moment-to-moment analysis. And based on this data and what you can see on the chart, the live action narrative video produced through CHIPS was the most liked. Before we jump into the actual data, I just wanted to share with you how to read the graphs. So for example, this is the total average for the Houston news video outlet or news outlet video. The sliding scale starts at 50 at the beginning of the video, and as the surveyees move the bar up or down, you can see the graph change. So by looking at this graph, you can see that the graph is separated by time segment and the line moves as the video plays. This is the CRM crosstab based on ethnicity, and I know it's a little difficult to see, but while there are slight variations based on race, it stays pretty consistent with the overall likability we saw on the chart 2 slides ago. Something interesting is that Hispanic surveyees actually enjoyed the animated OSHA video best for an average of 71.55 on the likability scale, and every other group enjoyed the live action chips video the best. And then these are the crosstabs based on residency. There's very little variation from the overall average. Rural residents tended to not like any of the videos as much as suburban or urban residents, but the data stays pretty consistent with the overall results. And then trustworthiness was evaluated using descriptive statistics of a 5-point Likert scale question. As shown in the chart, the live action chips video and the animated OSHA video tied at 4.24 for the average level of trust. But honestly, overall, each video was considered pretty trustworthy. So, what does this mean for communication professionals? As the results show, live action narrative videos are the most likable form of content when communicating heat-related illness risk. Audiences really like to connect what they're seeing on screen to themselves in their own stories, but the animated OSHA video gained the same level of trust as the live action narrative. Additionally, Hispanic populations, which is a majority of our farm workers in the US, liked the animated video just as much as the live action video. For professionals, this means likable and trustworthy videos can be produced in-house and at a very low cost. Communication materials can be distributed within days instead of waiting months for a live action video to finish production. Future research should examine the effectiveness of different narrative styles. Variances could be seen when showing narrative style animation, narratives in different languages, such as Spanish or Haitian French, and narratives surrounding the actual farm workers. Additionally, future research should explore the effectiveness of various types of animation and other types of videos in educational and informational context. The findings of the study indicate that the OSHA animation was perceived as the most trustworthy, and given that animation is a cost-effective medium, it presents a really viable option for organizations seeking to disseminate information. Here's my 1.5 million references. So I know it's hard to read, but if you have a question about a specific reference, you can email me and I will send it over to you. And thank you so much for listening to this presentation. Like I said, it was truly a labor of love over the past 2 years, so I'm very grateful to have gotten to share it with you all.
Thanks so much, Astrid. Let me share my screen again. All right, now we can open it up for Q&A. I see we have quite a few, so we'll get started with the first one. I think this is directed at Alejandro. So there's a question saying, was the survey conducted in multiple languages? If so, what other languages besides English?
So the survey was conducted only in English. It was distributed around Florida, and yeah, it was only in English. I don't think it was conducted in Spanish.
All right. And then you kind of answered the second one. So how was the survey promoted or distributed?
Right, that's a good question. I personally didn't work directly with the survey application and administration. I used the data from the survey, but I know that it was distributed to Qualtrics, which is an online platform, and it was distributed online. It was a survey they filled and completed online.
Yeah, and if I'm remembering correctly, I wasn't involved directly with the study, but I know people who were working on it. I believe it was part of a Qualtrics panel that matched the census, right? So that's when Qualtrics distributes it specifically so that the respondents match the Florida census, so it's more or less representative of the Florida population. We do have other surveys that or we have one specifically that has happened more recently that was distributed in French and Spanish, but the results are not available yet, but that may be a webinar in the future if you're interested in multilingual results. Okay, and then we have another one. Alejandro how was the survey developed and about how many questions were on the survey? As we know that lower literacy people may be less inclined to do an online survey, especially if it is long.
Right. So the survey was developed mainly in two main parts. Demographic parts, which basically ask them to feel what kind of education they'd have, the income that they receive. It was an anonymous survey, so none of the personal information was disclosed. And the other portion was more focused on these aspects, like in the past few years or in the past few months, sorry, how much time did you seek for shape when you were exposed to heat? How often do you avoid to work when there are extreme heat events? And the responses were categorical, like basically no at any time, pretty often, often or every time. So and also the distribution of the questions and how much do you trust in the Department of Health for heat related illness information, and the responses were very much, you know, somehow, not too much, or not at all. So they were categorical questions, and they were easy to respond, and they were around 20 for demographics and around other 30 for the preventative behaviors and the seeking information and trusting information too. It was around 15 to 20 minutes to complete the survey.
Right. Next question. So this is for, I believe, Astrid. So how were people recruited to watch and evaluate the videos?
Yeah, for sure. So we did everything through Dialsmith, which is an online survey instrument. And they're really great because you can pay them and they do all of the recruiting and data collection for you. But we had an astounding amount of respondents. We had over 1,000 people respond to this. And I really do attribute that to Dialsmith having those resources to recruit that many people.
All right. And then, so Jeannie says, and Jeannie is with Florida Farm Workers, we would be very interested in seeing both of these research projects as we are working on creating several videos for farm workers. So this might be a good segue. Astrid, do you have any future plans for publishing or making your data available publicly?
Yeah, definitely. So I presented this at the Association for Communication Excellence this summer, and we're hoping to get it published very soon. We've submitted it to the Journal of Extension. We'll see if it gets, selected, but hopefully I'll be able to share it with you all as soon as possible.
Yeah, and any of these heat-related illness resources. So on the Ag Safety Center website, we have a heat-related illness toolkit where we've compiled information, resources, research, and deliverables from a bunch of different researchers that we've collaborated with, similar to Alejandro and Astrid, and we make them all publicly available there. So once we have something that is published and online, we'll put it there for everyone to find. And then finally, a lot of farm workers may not be on the census data, right? So in other studies where they might be more targeted to a specific population, that might be a different sampling technique. But I think with these panels, they're census representative. All
Can I
right.
show my screen for a little moment
Yeah.
just to
Yeah, go
respond?
ahead. I'll stop sharing.
Thank you. So here we can see the sample size, which is something very important. You know, I don't know if you can see my mouse, but I'm pointing to the little like rectangle in the left part of the model. And here we can see the sample size. And actually what you're saying is true. We might not be capturing a lot of the farm workers because of, potentially they might be migratory individuals that may come from Mexico or something, so the language is different. And also, there are a smaller population when you compare to the overall Florida population. So that's a good insight, and it's something that we made sure to include in our results and also in when we produce the paper too.
Thank you for clarifying, Alejandro. Any more questions before we wrap up? Seeing none. Make sure. Okay. Yep, we're good. So I will follow up with everybody who registered for this webinar with an evaluation survey. We would greatly appreciate it, especially these awesome presenters volunteered to present as they're still part of their graduate programs. So they would love any feedback on their presentations. I would love any feedback on their presentations so that we can continue to plan webinars for you all that are relevant and applicable to what you're all doing. But yeah, if you have any questions for the presenters, their contact information is on the webinar page on the website. Let's see. And I'm sure they would be happy to answer any questions that you have. All right. So with that, we will go ahead and end the webinar. The recording will be available after the fact in case you missed anything. But other than that, we'll go ahead and sign off. And if the presenters, if you could just hang out for a little bit while I close out the webinar room. Stop the recording.